Hi, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and I've been in practice here in Chester County since 1999. Our practice, Corrective Chiropractic Neurology and Functional Medicine Center, specializes in treating patients with chronic neurological conditions, especially children with neurodevelopmental conditions such as autism, ADHD, Asperger's syndrome, OCD, PDD-NOS. We also see children with learning disabilities such as reading disorders and dyslexia. Now, if you're on this website, ChesterCountyNeuroBalance.com, or if you're watching this video, I'm sure that you either know somebody that has a child or teenager with one of these conditions, or maybe you have a child or teenager yourself that's suffering one of these conditions and you're concerned. You're concerned about the way it's affecting them in school. You're concerned about their social skills and their ability to meet friends. Or maybe they've been diagnosed with, for the first time you've heard that they have an autistic spectrum disorder. And you're looking for some answers. Well, this website here I'd like to welcome you to, number one. But it's also going to be a website where you're going to get some information that can be very much life-changing to your child. The information that you're going to hear today is going to be about a drug-free approach to helping children with these disorders. Now, typically when you first find out that your child has an autistic spectrum disorder, or you go into the school and they've been tested at the intermediate unit and possibly you find out that they have dyslexia or a reading disorder, typically what happens is either you go to your medical doctor or you go and have neuropsychological counseling or neuropsychological testing done on your child, and they determine that yes, your child has ADHD or has one of these disorders. Typically, the first line of defense is either medications or special placement in school where they're maybe placed in special classrooms or something of that nature. Typically, what is not explained is a neurological drug-free approach to helping these children. And that's what we do in our office. We treat children with these types of conditions neurologically and metabolically. This website here is designed to educate you and give you hope that there is an approach out there that is different. And so just to give you a little understanding of what we do in our office is we treat patients and children with these disorders from a hemispheric-based neurological approach. Essentially, we know that the brain has two sides. There's a left brain and there's a right brain. And each side of the brain has different set of aspects or certain set of skills, if you will, that they take care of. So the left side of the brain, for instance, controls fine motor skills. The right side of the brain controls gross motor skills. The left brain is the gas pedal, and the right side of the brain is the brake pedal. Most of these issues that these children have, particularly ADHD and autism and things of that nature, are due to a weakness of one side of the brain versus the other side of the brain. And we call that a hemispheric or a functional disconnection syndrome. And so basically what will happen is one side of the brain will develop weaker or slower. For instance, in cases of ADHD, autism, Asperger's syndrome, OCD, obsessive compulsive disorder, PDD-NOS, which is pervasive developmental disorder not otherwise specified, these are all right brain deficiencies. So the right brain, again, is the brake pedal of the brain. Okay, so it stops motion, it stops movement, it stops thought. So if we have a child that has hyperactivity, typically they have a weakness on the right side of their brain. The right side of the brain is for reading comprehension. Okay, where the left side of the brain is actually the linear brain, that is the verbal side of the brain that actually allows you to read the words phonetically. So kids with dyslexia or kids with reading disorders or various types of learning disabilities typically have a deficiency of the left side of their brain. They'll have trouble with reading, they'll have trouble with verbal fluency, they'll have trouble with memorization of facts and figures. Whereas a child with autism or Asperger's, their right side of their brain is weak and their left side of their brain is strong. So they're very good with facts and figures, but they may not see the big picture. They may have problems with social skills, or they may have problems with eye contact, and different things of that nature. I go into this aspect of care very deeply in the other videos on this site. So if you look above you, right here, you'll see that I have a section that you can click on for ADHD, a section for autistic spectrum disorders, for kids with autism, high-functioning autism, Asperger's syndrome. There's also a section you can click on for dyslexia and reading disorders. I would recommend that you go, if you have a child or teenager or a loved one with one of these conditions, I would recommend that you read and watch the videos on that. I will go through all of our neurologic and nutritional approaches to care for those specific conditions in great detail. Other aspects on this site are our neurological or our advanced neurological testing. I would recommend you look at that. When we test children with these issues, we do a very comprehensive neurological exam to determine what area of the brain is of concern in these cases. So I would recommend taking a look at that. Also, there's a section called Brain Balance, and you can take a look at that as well. It is a section that will go over the difference between left and right side of the brain. There are testimonials of patients that we've helped. I would recommend you take a look at that as well. There's also a section on research. This type of care, this hemispheric neurological drug-free based care, is grounded in science, it's research-based, it's evidence-based, and I would recommend you take a look at some of the great research that is on this site. So welcome to this site. There's a lot of information on here. If you have a question about any of this, there is a section on this site that you can put your name and telephone number in, and we will contact you and we will give you what we call our free 5-minute consultation, where we can go over some of this stuff on the phone with you and answer any questions that you may have. If after taking a look at the videos on this site and looking at the information on this site, you're interested in having your child be examined in our office, for having a functional brain assessment, I would recommend that you give our office a call. Again, our contact information is here. So thank you, enjoy the site, and if you have a child with one of these conditions and you would like to have them come into the office, we look forward to helping them out and determining whether they can be helped with our therapies. Thank you.